Welcome back to The Explainer. So today we're exploring the really intricate, interconnected world of anterior uveitis. And look, if you think eye problems are just isolated to your vision, well, this might completely change your perspective. We're going to see how localized inflammation right there in the eye can actually be a huge, crucial indicator for systemic issues happening throughout the entire rest of your body. Let's get into it.
Okay, let's dive into this. The source material we're working with today is literally pulled straight out of a third-year Doctor of Optometry medical curriculum. Seriously, we are breaking down high-level, clinical-grade diagnostic material today. But don't worry, we're going to decode this entire professional medical framework together. So here is our clinical treatment plan for this explainer, taking us on a journey from the eye itself into the rest of the body, and then finally into the pharmacy. We'll hit 1. Diagnosing anterior uveitis. 2. The systemic connection. 3. Treatment protocols and steroids. And finally, 4. Managing specific medications. All right, kicking things off with Section 1, Diagnosing anterior uveitis.
Our starting point is the condition itself, anterior uveitis. Clinically speaking, what this actually is localized inflammation occurring specifically in the front portion of the eye. Before we can even begin to unpack the complex biological web this belongs to, we really have to ground ourselves in this basic physical reality first. Basically, the eye is acutely inflamed and extremely reactive. Moving right along to Section 2, the systemic connection. Now, what do your joints have to do with your eyes? It kind of sounds like a trick question, right? Because most of us just naturally assume that if our eye hurts, well, the problem starts and ends right there in the eye. But biology is rarely ever that isolated. We need to completely challenge that assumption to really grasp how optometry actually works. The eye is practically a window to the rest of the body. Just look at these connections. A patient coming in with this inflamed eye might actually be dealing with an underlying musculoskeletal issue. Or, they might be exhibiting signs of Reiter's disease. It could even be tied to being HLA-B27 positive, which is a genetic marker linked to much broader systemic inflammation. So the eye isn't always acting alone here. Sometimes it's literally just the alarm bell for a fire burning somewhere else entirely. Which brings us to Section 3, Treatment Protocols and Steroids. Okay, I want to deliberately slow down for a second here because this next point is absolutely vital. If using steroid drops, only use them for the front of the eye and strictly short-term. This is definitely not some casual suggestion, guys. It is a hard and fast clinical rule. Steroids are incredibly powerful tools, for sure, but using them long-term or incorrectly, that can cause severe patient harm. The treatment protocol here has to be as precise and strictly managed as the diagnosis itself. No exceptions. And that leads right into our final section, Section 4, Managing Specific Medications. Let's take a really close look at the drug Prednephrine. And this brilliantly illustrates the nuance we're talking about, because this specific medication has these unique dual actions. Sure, it treats inflammation, but it also has this mild pupil-dilating secondary effect that a doctor absolutely has to account for. But here's the kicker. Despite its anti-inflammatory abilities, prednephrine is actually way more commonly used in corneal disease rather than your standard cases of anterior uveitis. It just highlights how carefully a doctor has to balance a drug's primary strengths against its very specific use cases. It's like a giant puzzle. So, that brings us to our final thought for today. If our eyes can warn us of systemic, body-wide diseases, what other seemingly isolated symptoms are secretly connected? It really makes you rethink how the whole human body operates as this intricate machine, doesn't it? I mean, nothing exists in a vacuum. Anyway, thank you so much for joining me for this explainer. I really hope you found it as fascinating as I did. Keep learning and keep questioning the connections all around you.